It's not just fiber that can help improve colon health. Screenings are an important way to ward off colorectal issues in the future. But even though screening for colorectal cancer has been shown to decrease deaths from the disease, only about 2/3 of Americans are up to date with their screenings. This year alone, over 100,000 new cases of colorectal cancer are expected to be diagnosed, and more than 50,000 Americans will die from the disease. Colorectal cancer is more likely to occur as people get older. According to the American Cancer Society, more than 90% of people with the disease are diagnosed after age 50. March is designated National Colorectal Cancer Awareness Month. We spoke with a specialist at Advanced Gastroenterology and Surgery Associates to find out how early detection can make a difference.
Colonoscopy screening is extremely important, and I think it's important to note that colon cancer is the second most common cause of cancer death in the country, and the third most common cause of cancer in men and women. And most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps that can grow and eventually turn into colon cancer. It's important to note that the normal cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps.
If you go back and you listen to folks who have gone through the prep on the day of the procedure, and I always talk to patients, well, how was your bowel prep, and did you have nausea? Oh, it wasn't so bad. Many years ago, the drink is quite salty, and then the volume is because it will distend the stomach and may cause nausea. But it has come a long way. Bowel preps today, the ones that we use for our office is actually odorless, tasteless, and gritless. So essentially, the folks will taste the drink, the flavor of the drink that they put into. So it is not as bad.
The preparation is very important. We have to cleanse the colon. The colon has to be clean. The cleaner the colon, the better we see. The colon has a lot of folds, there's a lot of spasm, so you can actually miss small polyps, so there's always a potential miss rate for colon screening. So the preparation is very important. The actual procedure itself is relatively benign. Patients are sedated, either with moderate sedation or some even with general anesthesia.
We look for any type of pathology or condition in the colon, and they can be as benign as internal hemorrhoids, pockets in the colon called diverticulosis, as well as polyps, and any kind of lesion that can either be biopsy or removed. Also, there are conditions, for example, people may come in with bowel habit change, such as having diarrhea and whatnot, and colonoscopies will obtain a pathologic diagnosis by removing tissue samples and looking under the microscope. And so colonoscopies are very, very important for being able to detect malignancy. That's the most important thing, and colon cancer is very preventable if we are able to diagnose it before it gets there.
For more information on the Advanced Gastroenterology and Surgery Associates and their services, please click the Colorectal Cancer Awareness story link icon on our homepage at yourhometownhealth.com.